And I'd first like to invite Arshya Vahabzadeh, all the way from the US. Arshya is a Harvard-trained physician, technologist trained in pediatric psychiatry, adult psychiatry, and family medicine. He is a clinician first and foremost, with a special interest in technology. He's Innovation Officer of the Massachusetts General Psychiatry Academy and the Chairman of the Council of Communications of the American Psychiatric Association. He is an expert on the use of new technologies for mental health disorders. Dr. Vahabzadeh has received over 20 national and international awards and has been recognized as a 40 under 40 healthcare innovator. He believes that a convergence of clinical neuroscience, data science, and exponential technologies can result in transformational change in mental health. Welcome.
Great. Thank you so much.
Right.
Thank you so much, Sano. Wonderful to be here. Thank you. Thank you so much. So thank you so much, Sano. And it's a real pleasure to be here in Melbourne, Australia. It's actually my first time to Australia, and it's been a great experience. It's wonderful to be here with Psych Scene as well. It's good to see such a kind of progressive organization bringing us out and for us to learn about what's happening here and also perhaps just an exchange, a flow of information. So today, I just want to understand perhaps a little bit about the audience. Who are you guys and women in front of me? So what is the background of people here? Are most people psychiatrists by training? Could you put your hands up if you're a psychiatrist? Okay. Are there other clinicians here? Psychologists and general practice? Wonderful, Matt. Psychologists and general practice. Wonderful, wonderful to have you. Are there any patients here who have kind of come to be with us today, or caregivers, or anything like that? Any technologists? Any technologists? Yeah, right. Ned, my co-speaker, and anybody that I've missed out? Trainees. Are there trainees here? Wonderful. Good to see you. Thank you. So this is very helpful for me to understand the audience and who I'm talking to. So a lot of the people here see patients, presumably, or do research. So maybe I should start by saying, look, I'm going to be talking about lots of really cool technologies and amazing things and speech analysis and how smartphones are going to be the future and all this kind of stuff. And part of me does really believe that there's really extraordinary changes that are going to be coming. But part of me also knows that many people have said that changes in brain science and neuroscience are going to dramatically change the field. But as a frontline clinician, I haven't seen that really happen in any dramatic way. And one of the things I actually work in psychiatric emergency rooms in the United States and also in a maximum level correctional facility. And in those settings, I actually do that as one of my full-time jobs, apparently. So I've got several of those. But at the very front line, we aren't doing the basics right because we don't have funding, we don't have resources. So, for example, in some of the kind of emergency settings, you may find we're running way over capacity in terms of patients. Patients aren't allowed to leave because they're on legal holds. And if they have to stay overnight, some of them end up sleeping on the floor because there's not enough beds and we're over capacity. Would that be acceptable for a patient with angina or diabetes? No. So why is it acceptable for our patients? So I just wanted to say that because there's so many very basic things that we need to kind of get right, get funding, and make sure politicians and other people recognize the important, valuable work that we're doing. So with that said, I'm going to start my presentation. So first thing I'm going to do is show you the globe and say, where are we now currently? So a lot of the time clinically, we are using categorical diagnoses. So we say, does this person have depression or major depressive disorder or anxiety or these big categories? Now, to me, that's kind of like saying, oh, what's your address? And I'm like, I'm on planet Earth. That's great. It's accurate. I mean, we are on planet Earth, but it's not very precise. Like where are you exactly? And then that leads researchers to want to be more involved and more knowledgeable and try and really pin things down. So we use severity ratings and different kind of tools, patient reports. And what that's like is saying, what's your address? And someone saying, oh, I'm in North America, or I'm in Australasia. So we're getting closer. But still, the next step, and this is the step that technology can help us with, is where exactly are you? Oh, I'm in the Rialto, and I'm in a symposium, and this is my address. I'm going to send you the map so you can come and meet me here for a coffee or a chat. So that's where I think we're going to go as we get more data science involved and as we get more quantitative metrics. So with that said, I'm going to start the rest of my presentation. So what are the key issues in mental health? They're pretty much the same issues we have in health in general, in healthcare in general, except stigma is a bigger deal for us. We get stigmatized as clinicians, as researchers, and also our patients face an enormous amount of stigma and are somewhat disenfranchised. Now, I wanted to show you this slide. This slide is a little bit important to me because this is actually a global disability. And this actually maps out lots of different conditions relative to mental health. And mental health is actually the pink bit in the middle. And the age is actually on the horizontal axis. What's very interesting here is that you could see that a huge chunk of disability is happening in the younger age groups, in young people, adolescents, and adults. So when we're talking to our colleagues and they're saying, cancer is a big priority for us, cardiovascular disease, respiratory disease. No, they're right, but what is disabling our youth and young adults? And a lot of these conditions tend to last throughout life. It's not just the personal cost, it's the global cost. So based on global analysis, these are some charts for China and India going out to 2030. Mental health, in terms of the non-communicable diseases, is going to be the biggest economic cost for these countries. It outweighs cardiovascular disease, respiratory disease, cancer. So these are the things that we have to point out to people and saying, hey, you think it's bad now. Our conditions are costly on their own. They drive the costs of all these chronic conditions we have to deal with in healthcare. And it's going to get worse. I mean, the projections are there. This is a slide from the US. This is actually the disability, again, based on these non-communicable disease areas. And again, if you look at the orange line, that's mental health. That's mental and behavioral disorders. And again, you see it's much higher than the other conditions for most of the lifetime. And at age 35 or 40, it is higher than all the other conditions combined. Again, it's disabling our youth. In the US, our suicide rates are actually rising. Suicide is a top 10 cause of death. And we have many, I looked at some statistics in Canada, for example. And in Canada, it's the second most common cause of death for young Canadians, age 15 to 34. So it's disabling youth, it's killing youth, it's killing us. It's costing countries. So, face a global mental health crisis. So it takes millions and decades to train probably any of us in this room. We're all clinicians, nurses, residents, psychologists, psychiatrists. But what can technology do really quickly? We can get huge amounts of data very quickly and produce reports. Depends what we need to do with those reports, what actionable steps they bring. We can download apps and all these different bits of software to run on our very unique smartphones. I don't know why we call it a smartphone, because that's often the least that people do on it. People are using it for all these other reasons. All these technologies are converging and being integrated into this smart device. And we can run clinical simulations almost instantly. So some of the work that I do and you will hear about is with brain power, and we're using a lot of augmented reality technologies. And there's a lot of companies using virtual technology. I don't know how many of you saw Mark Zuckerberg's broadcast yesterday about using virtual reality technology. But it's huge and it's going to become much bigger very quickly.